Honorable Health Minister. Namaskaram. Greetings to you all. Thank you. I'll kick it off on that note, seeking divine blessings. Just to introduce myself, my name is Irfan Malik. I'm the Global CEO of InQ Innovation Global. We are an ecosystem enabler in the startup innovation space. I'm also the Global Chair for Startup Science and Innovation, part of World Malayalee Council, one of our co-organizers, and also the Chair of Startup Innovation.
Thank you. I think you belong to TK group.
Yeah, we're part of the family. Yeah, thank you. Appreciate that. Thank you.
My stand is that.
Okay, thank you very much. We're live now, and I welcome all the panelists, all the leaders who are on board this session, and also the audience. Just to kick off, again, hello and namaskaram to all of you, and greetings and wishes as well. Ellarukkum ende nalla aashamsagal. That's in Malayalam, as we wish. I would kick off by acknowledging the traditional owners of the land we are having this meeting here from, and I pay respect to the traditional owners, the elders past, present, and the emerging as well. Now, we're all, and as we speak, and we need to recognize that we are all in a cautious COVID situation. We won individually the states that we represent, both New South Wales and Kerala. We have had some good battles that we won, but still we are cautiously dealing with the situation as we are here as well with all the social distancing in this boardroom. But the war is not over yet, and I recognize that, and we will work towards that. Now, together, and I want to recognize both the states, and we've got government representatives from both the states of New South Wales in Australia, as well as Kerala in India. We've had great wins, but it's a great honor to have our Honorable Health Minister from Kerala, Srimati Shailaja Teacher, who has accepted this invitation to come on board, share her insights. So it's a great honor to have you here, Shailaja Teacher ji, and yeah, we'll welcome you. I also want to reflect on the great time that we are dealing with the whole Australia-India friendship and relationship, and at the back of the recent virtual summit that both the Prime Ministers of Australia and India had. Now, this is just great time where across sectors we're having great conversation, great exchange, and business trade activities already kicked off. So this is great timely occasion that we are having this conversation to spark off and build on this relationship. Now, some of the key takeaways that I would expect and would like to offer to everyone and the audience as well. This is a spark-off session and a conversation builder. We've already had conversation, but it's a spark-off session to lead to, learn from obviously insights being shared, some of the best practices being shared across both states, but focus is on opportunities for collaboration post-COVID. How do we really face and obviously get through the rest of this situation? How do we overcome that? But also beyond that, how do we collaborate in terms of research, innovation in healthcare, and also supply chain and healthcare service delivery as well? So that's something which we will get some opportunities that we will talk on. In fact, I'm sure that some of the leaders here, again, are going to exchange some of the opportunities that's in play currently. And we will also look at some of the follow-through outcomes as well that we are looking at between Kerala, the whole of India, as well as New South Wales and the whole of Australia, and the exchanges as well. I want to, on this note, recognize our co-organizers. The other hat I wear as well, World Malayalee Council, which is a global organization of diaspora of Kerala, Malayalis of origin from Kerala, and who are widespread. In fact, I want to acknowledge all the hundreds and thousands of healthcare professionals and nurses. In fact, nurses from Kerala have been, it's a folklore that we have global presence of nursing staff from Kerala who serving the communities globally as well. So definitely thoughts to them and the whole World Malayalee Council, the organization and the Sydney chapter. I've got folks here, Kiran, Abbas, Uncle Anas and Babu Agis uncle all with me here who put together this event. I want to also recognize Barbara and Impact One who've been a great support for us and pulling together this event. George Institute, Tim, Steve, and your team, great to have your support. And also the Australia-India Institute, Tanya and team, Kerala Startup Mission, our partners in Kerala driving startup innovation, our media partners, Metro Malayalam and team, We Breathe, which is a emerging healthcare startup, which we'll hear a lot in the space, in the Australia-India space, and numerous other supporters of this event, and great audience that we've got currently, and all the audience, this is being beamed and streamed as well. So I recognize all of them and all of you. And again, thank you for joining on board. And on this note, I will invite Babu Verghese Uncle, who's the president of World Malayalee Council Sydney chapter, to do the formal welcome note to all of us.
Thank you, Irfan. Good evening, Australia and Singapore, and good afternoon, India. Honorable Kerala Health Minister Srimati Shailaja Teacher, distinguished guests, and dear brothers and sisters. It's given me great pleasure and privilege to welcome you all for this webinar. Our Kerala Health Minister Srimati Shailaja Teacher, thank you for accepting our invitation in your busy schedule. We highly appreciate your great work, enthusiasm, and dedication towards the Malayalis in this COVID-19 period. On behalf of World Malayalee Council, Sydney Province, and Innovation Global, I would like to extend a very warm welcome to you for this function. We have a few more invited guests today. Honorable Scott Farlow, MLC, Parliamentary Secretary to the Treasurer, New South Wales Government, Professor Dr. Stephen McMahon, Dr. V.P. Nair, Professor Jeremy Chapman, Honorable Jason Florensky, Mr. Gamey Lloyd, Dr. Christy Fernandez, Ms. Tania Spishba, Mr. Dilip Ibrahim. Thank you all for accepting our invitation. Your time is with us, highly appreciated. On behalf of World Malayalee Council and Innovation Global, I extend a warm very welcome to you all. Mr. Irfan Malik is our moderator today. Irfan is the CEO of the Innovation Global and WMC Asia Pacific Regional Director. Thank you, Irfan, for accepting and doing this initiative to organize this meeting today. Many of our members and well-wishers are attending this meeting from this or their own places. We welcome you all. My best wishes to all of you. Have a great evening. Thank you.
Thank you, Babu Verghese Uncle. Great to see your support and the support of the community here as well, which is again working through all these challenges that we've had here in Australia as well, and World Malayalee Council, along with the Sydney Malayalee Association and the rest of the communities across the state. We've been actively working as well, and I recognize all their work as well. On this note, I would like to invite Honorable Scott Farlow, our New South Wales Government Ministerial Representative, the Principal Secretary to the New South Wales Treasurer, to address this gathering and also the audience globally on this note. Thank you, please.
Irfan, thank you very much. Thank you to NQ for putting this on. And of course to Babu and the World Malayalee Council, thank you very much as well for making this event possible. And one of the things we of course are removed from each other in a physical sense when it comes to COVID and the restrictions in place, both in New South Wales, Kerala, and around the world. But it is a great opportunity for us to be able to come together, and of course to have such a wonderful speaker that we're all here to hear from in the Honourable Minister Shailaja Teacher from Kerala. Thank you very much for joining us. I would love to have you come and physically see us in New South Wales, and to have you as our guest here in the state. We would love to have you, but looking at the approach, of course, of New South Wales and of Kerala, they're very similar in what we've both done when it comes to COVID, which is effectively following test, trace and isolate to make sure we can get on top of COVID. And looking at, of course, the great work in Kerala, which is a beacon when it comes to India and the response in India. It is something that New South Wales has got similar problems to Kerala. We have a lot of international exposure in New South Wales as a gateway to Australia, and the same as Kerala has had a lot of international exposure and exposure from around India. But New South Wales maybe doesn't have the same experience that Kerala has when it comes to pandemics. And of course, I note the response of Kerala in 2018 and the learnings you have there, which have held you in good stead when it's come to fighting the battle with COVID. So just a little in terms of New South Wales. New South Wales it's got its first coronavirus case on the 25th of January of this year, where there were 3 cases recorded in New South Wales from returned travellers from China. Thanks to the great work of the Australian government, and I recognise my federal parliamentary colleague, Jason Falinski, the member for Mackellar here as well. Thanks to the great work of the federal government in moving quickly to stop international arrivals from China, and then following that from Iran, from South Korea, and from Italy, that were COVID hotspots, Australia was able to keep on top of it, but we started to see a significant rise in cases in New South Wales and around Australia. New South Wales started to get to the point where it was seemingly an exponential curve, with cases doubling, or at least the trajectory of cases doubling every 3 days, with 212 cases per day being recorded as our largest number. But thanks to the work of the community in New South Wales, and thanks to the work of our health professionals, of which I note, Irfan, to your point earlier, the Malayalee community are on the front line when it comes to providing health services around the world, and particularly in New South Wales as well. Our hospitals throughout Western Sydney, many Malayalee health workers I know from our community of about 12,000 strong Malayalee in New South Wales, and we thank all of them for being on the front line. But I'm also aware that that's not just in Western Sydney and in the metropolitan region, but in the regions as well. So I know that there's Malayalee health professionals in Tamworth and Bathurst too on the front line doing such a wonderful job. So we thank all of them for their work on the front line of fighting COVID. But because of that work and because of the actions of the community, we got on top of COVID very quickly when many thought we couldn't, when many were predicting that cases would be doubling within days and within weeks, and that Australia was only a couple of weeks behind Italy, a couple of weeks behind the emerging problems at the beginning of March in the UK and the US. We saw, of course, our curve not just flatten, but our curve take a stark downward trajectory. And we're seeing at the moment a position where there have not been any community transmission cases in more than 2 weeks in New South Wales. The daily coronavirus cases are coming entirely from our quarantine hotels, where, of course, return international arrivals are required to quarantine in a hotel for 2 weeks. And so we are now focusing in New South Wales very much in terms of easing restrictions, with the Premier further announcing the easing of restrictions today. And that's been the case since about the 1st of May, that New South Wales has started to ease restrictions in the state. And we're very focused now on our economic recovery as well, getting people back to work. We feel at this stage that we have more than tripled our intensive care capacity in New South Wales. When we look at where we started, it was all about being able to ensure that we flatten the curve to be able to maintain our intensive care in New South Wales and be able to maintain our intensive care capacity. That has been achieved. We've tripled our intensive care capacity and the number of ventilators we have. We don't actually have any cases in intensive care in New South Wales at the moment. We've spent $10 billion when it comes to both increasing our coronavirus preparedness in the health system, economic stimulus, and also the relief from government taxes and charges from the Treasury side. $10 billion has been spent as a result of the COVID pandemic. And when we look at our trajectory going forward, we want to make sure that New South Wales can turn around, that we maintain a COVID-safe economy, that we learn the lessons from other countries that have had to retreat back into lockdowns and further restrictions, and that New South Wales can have a gentle easing out of the coronavirus restrictions and start focusing on our economic recovery. And that's very much where we're looking at now. As we open up restaurants, we open up our economy. The Premier announced today the further easing of restrictions for people visiting each other's homes, for public gatherings, and also for the reopening of food courts with more restrictions to be eased imminently, the Premier announced today. So in New South Wales, we're proud of what we've been able to achieve. The current state of play is about 3,100 coronavirus cases. Sadly, 48 people have lost their lives due to COVID-19 in New South Wales. But as well as Kerala, we've been very strong with our testing regime. So in New South Wales, there's now nearly 600,000 tests that have been completed, which is some of the highest figures in the world. Our contact tracing has been with military precision, and the military has been involved as well in that contact tracing program. And of course, when we talk about the collaboration globally, as well as how we look to India to collaborate, and I know that when it's come to medical supplies, India has been at the forefront of being able to supply Australia with some vital medical supplies, and we thank the Indian government for their cooperation in that regard. But Singapore as well, with Dr. Nair joining us, and we'll discuss, of course, collaboration with Singapore as well. But the COVID Safe App that the Australian government has rolled out is based on the open source code of the Singaporean government's Trace Me app, I believe it's called. So there is some of the collaboration that we've seen globally in coming together to fight COVID-19, and long may that continue as we move to the next stage of being able, in Australia at least, and particularly in New South Wales, to be able to reopen our economy, look for a COVID-safe economy, look for how we can keep our community safe, but return to some new normality living with COVID. And of course, as we work together globally to try and find a vaccine, of which New South Wales and Australia have been at the forefront of. And I notice that, or I should say I note, that the Australian government's provided $300 million to the global Gavi vaccine initiative, and the Indian government has also provided $15 million to that initiative as we all work cooperatively together to collaborate globally in being able to ensure that we can find an immunisation for COVID so that we can get back to a new normality. And that's something that will require global cooperation. And I look forward to the discussion tonight as we look at more ways that we can collaborate globally, and particularly with Kerala and New South Wales together, looking at ways we can learn from each other in fighting COVID-19 and moving into the next stage. Thank you very much.
Thank you, Honourable Scott Farlow. Really pleased to be where we are, and thank you for all the support from the leadership, the government, and the whole healthcare professional, everyone, community together to get to where we are. And also thanks for sharing some of those insightful thoughts of what the government has been doing and the vision as well. So really appreciate the leadership from the New South Wales government on this, and the global leadership as well that's been demonstrated. Thank you for your time. Thank you. On this note, I would also invite Honourable Jason Felinski, federal member of Parliament from Mackellar, New South Wales, to share his thoughts, and again as a representative from the federal Parliament and the government to share his views and also interact with the panel here.
You've got me at a bad time because we're just having a division, but if you can ignore the bells, then I'll certainly do my best as well. Can I firstly thank you for inviting me today? Can I thank you for the work that your organisation does? Can I particularly mention Barbara Ward, who does an excellent job across your community and with parliaments both in Canberra and in Macquarie Street to ensure that there is very good connection between our community and the Parliament. And can I also, sorry about all these distractions, can I also, democracy keeps going, unfortunately, or fortunately. Can I also say, though, that this conference comes, can I also thank Scott Farlow, sorry. I agree with everything Scott has said, and it was very good to get that granularity of detail that I don't think we often get in the media and elsewhere about the impact that this virus has had on our community, the response in particular in New South Wales, and just the raw numbers of testing and cases, which has seen us have some of the best outcomes in the world when it comes to health outcomes. This panel meeting comes at an auspicious time because in Australia, and in India, people are looking at moving from the health crisis to now the economic road path or road map out of the crisis that we're in. And there is, without a doubt, innovation is going to play a critical role in ensuring that our economies and the people who live within our economies have a very successful and productive lives at the end of this, and that we're able to secure people's finances on the basis of economic hope and opportunity. And that is really the key for leaders at all levels to ensure that that happens, and innovation will play a key and critical role in that. So that's the first thing. The second thing is obviously that Australia, and I think many other nations around the world, have realised that our reliance on a very narrow group of suppliers in our global supply chains has been detrimental at a time of crisis. And therefore, we are particularly interested in diversifying where the people that we do trade with and our economic supply chains. So you will hear some people refer to this being the end of globalisation and many nations looking to insource their supply chains. I think the Australian government's approach will be very different on that front. What we will be looking at doing is, rather than withdrawing from the world, we'll be looking to strike out new alliances and double down on globalisation. India is clearly a key partner in us attempting to do that. As an emerging economy and economic superpower, Australia clearly wants to have very good links to India at all levels. The former Premier of New South Wales, Barry O'Farrell, is now our High Commissioner to India. That is an indication of how seriously the Australian government is taking that relationship. The Prime Minister, who I was talking to about a month or two ago, was making the point that his plan for 2020 was actually to start the year by visiting India, and he was laughing at how nothing he planned to be doing in May had turned out to be the case between bushfires and pandemics. So he's hoping that he will be able to reset next year and do what he was going to do this year, next year. But the point is that given that he intended to start the year by visiting India, that is a very important signal from the Australian government about how important we think the relationship between our two nations are. And so I think this, your organisation and the organisation of this panel, both at this time, is very auspicious, and hopefully there will be significant progress made here, both now and for our future, for our mutual success into the future. Thank you for having me.
Thank you, Honorable Jason Felinsky. Thanks for sharing those insights and those words from the federal government and parliament as well. We always look forward to the relationship between Australia and India, much more beyond the cricket and curry. We have a lot of trade and business that we are looking forward to. And I think the timing is right.
Well, I hope we can do
the is all great.
We don't have to give up the cricket and the curry. That's important.
So yeah, so look forward to, and again, the whole vibe between since last week as well. We've had so many interactions at various levels, and I'm really looking forward to a lot happening in the healthcare sector as well with innovation, and definitely, yeah, great to see that actuated as well at the session. Yeah, thank you very much again. Appreciate that. On this note, just doing a time check-in. I just want to call it out to the panelists and the audience. We are probably about 10 to 12 minutes late, but we'll see if we can catch up and see how good I am as a moderator to facilitate, but I'll see how I go. But just wanted to flag that anyway. But without much ado, what we've all been waiting for, I would love to take this opportunity to express our heartfelt thanks again to the Honorable Health Minister from Kerala. And I would love to hear her out. She's obviously someone we are all proud as someone who come from Kerala as our origin state. And it's with pride that we express our gratitude and respect for our Honorable Health Minister. And I'm pleased that we've got her here, and I will welcome and invite her to share her insights and thoughts. And then we go on to a Q&A session after that. Thank you, and over to you. Welcome again, Honorable Health Minister Shailaja Teacher ji. Thank you.
Honorable dignitaries who are participating in this August function, this discussion, my dear brothers and sisters. The whole world is fighting against this peculiar virus, we can say so, because the virus didn't reveal its behavior totally. And I think scientists are saying some mutations are happening in this virus, some changes are happening. There are so many strains. And even if it is said that its mortality rate is less, but no use of that because the infectivity rate is so high. That's why people are dying in bulk. Thousands and thousands of people are succumbed to death up to this time. And the whole world is fighting against this deadly virus. And our country, India, is also fighting hard to tackle this problem. And in Kerala, we also are fighting against this virus properly. And our India government, our ICMR and other scientific organizations also are helping all the states to fight against this deadly virus. And in Kerala, we started the preparedness earlier. And that is why we yielded some good result out of that. But it doesn't stop here. Now the third wave occurred here, we are fighting again. In the first phase, when we heard about a peculiar virus or a potential virus is there in Wuhan in China, that's in January 2nd week. January 18th, WHO, there is a statement from WHO that a potential virus is there in Wuhan. It is not identified. It is in the corona family or SARS virus family. Like the SARS and MERS, it is in that family, corona family, and it is spreading there. I happen to read that the WHO statement and other some articles, etc., about that. And at once we had a very good discussion on that. Me and my health secretary discussed, and our chief minister also inquired about that. And we expected that that virus will come to Kerala, because in Wuhan University, so many Malayali students are studying there. Definitely they will come back with that virus. We thought like that, and we started our preparedness here. Not only that, we had a previous experience on Nipah virus in 2018. That newly emerging zoonosis also occurred here in one of our districts. We have 14 districts in our state, and in one of our districts that newly emerged zoonosis, that Nipah virus also occurred here. At once he acted to contain that virus. At once he started our tracing and quarantine, isolation and treatment. For in the case of Nipah, as you know, there is no medicine and no vaccination, and everything we are doing as experiment. We are treating for the symptoms, not for the virus. And that time we searched all the articles and all the literature, and we came in contact with the other countries also, and where Nipah occurred previously. We inquired how did they work at that time, and we are not satisfied with the protocol from outside, but we have to take something from that. We depended on the Ebola protocol mostly, and we framed a protocol to contain this Nipah virus, and we started working with our guidelines, etc. At once, we started to trace the people who got that deadly virus, and we find out the contact as much as we can. We tried our best, and we got all the contacts from our search. And we quarantined the people in their home, and we watched them. Our health workers were responsible to watch them daily, morning and evening, and we find out whether any symptoms are occurring in them. At once, we are shifting them to the hospital. That method we used at that time, and I think we succeed out of that. And at that time, 18 people got infected, out of which 16 succumbed to death because it is a deadly infection. We cannot save them. There is no medicine. And also, two saved, two were recovered out of that. That is a very good victory, and we are very happy out of that. I want to thank Australia also, because we happen to hear that there is a medicine, a human monoclonal antibody 102.4, something like that in Australia. But Australia didn't take patent out of that medicine. But it is stored in the Queensland government. It is in the hands of Queensland government there. We happen to hear it, and my health secretary and other officials started to inquire about that. And they understood that if government to government conversation is there, that medicine, we can get that medicine at that time. And we wrote to India government, our government of India, and they allowed, and our chief minister have some contact with these governments, both the governments, and at last Australia government agreed to transfer that medicine to us, and we airlifted that medicine from Queensland government and brought it there. But we didn't tried it because it is for a peculiar condition only. At that time, we are trying other medicine, ribavirin tablets like that medicines, and the two persons were recovering at that time. The other succumbed to death, and we didn't experiment that medicine, but we stored it here for a future precaution. We stored it here, and Australia government helped us at that time. I am expressing my thanks to that government also. And this time when Corona occurred, we again started the preparedness, what we had done for the Nipah virus also. And not only that, we have to have new advisories for this virus. This is a separate thing. Corona is not such a spreading type. Its mortality rate is higher than coronavirus. Nipah's mortality rate is high, but its spreading rate is too low. Whenever the symptoms occur, at that time only Nipah spread to other place or transfer to other human being. But in the case of coronavirus, without any symptom, from asymptomatic persons also, it is spreading to other human beings. And that is the difficulty actually. And when we heard about that thing in Wuhan, we started our preparedness here. We at once we formed we had a good meeting of our RRT and rapid response team, and also we opened our control room, state level control room here, and 18 expert groups for each and every team have responsibilities, and they started their action, collecting the logistics and also tracing squad training, etc. Everything we started. As we expected, January 27th, one flight came from Wuhan to Kerala, and almost 72 students or their relatives were with the in that flight, and In the airport itself, there was our screening team in the airport, and they traced them, and we got 3 positive cases out of them, and we admitted them to the hospital. And from them, no other transmission occurred at that time, and we contained that thing at that place. And all the 3 students recovered and left the hospital. We thought that we succeed, and that is a good sign. And someone said it is over, and no action need further. But we were afraid of this thing. We are watching thoroughly. We found that the virus is flying to other countries. It flew to Italy, to UK, and every part of the world. And again, we started our preparedness here, or we continued that preparedness. We didn't remove or withdraw our surveillance team from the airport. Someone asked me, why are you overacting? It is sent. Virus will not come again. And we cannot listen to that kind of advices, and we proceed to continue our preparedness and our awareness and vigilance. And as we expected, the other team from Italy came here, and out of that we got so many positive cases. One family without our notice directly go to their home, and they didn't reveal the identity that they are coming from Italy, and we have to trace them after that. But at that time, they visited so many houses, relatives, and they also got infected from them. But at once, when it find in our attention, we started our precautions, started the tracing, etc. And at that time, up to March 24, there is no lockdown or like that, like things here. All the peoples are coming from other countries and other states from to Kerala. From Gulf countries, so many peoples returned at that time. And out of that, we got 5 cases, positive cases. And after March 24th, the lockdown declared, and every travel stopped in the district, in the state travel, and also the out of the country, from abroad, people are not coming at that time, and everything stopped. Travel stopped because of this lockdown, and the incoming also stopped at that time. And we got that vital patients in our nutshell, and we acted on them, and we are able to contain that time. The second time also we succeed in containing that virus. The only small number of contact cases, not small, below 30% contact cases occurred at that time, and all the others recovered. Only except 3 old patients recovered and discharged from the hospitals. Only 3 deaths, and our case fatality rate was very low at that time. And that is also over. And after that, the whole countries have to lift the stringent activities throughout the world, and our country also lifted the activities, and we have to protect not only lives but also livelihood. As mentioned here, our Honorable MP and Honorable Stephen McMahon referred here, or pointed out that we have to protect the financial condition also. Financially, the world is going to a deep sea. We can expect this thing out of the lockdown and other thing. And we have to save the livelihood of people also. And in Kerala also, we want to open some area to have some agricultural work or some MSME works, etc. And we have to do that. But the thing is that if we cannot control this movement properly, that will become a community spread. And if it become a community spread, no one can do anything. The hospitals become flooded, and the workers, the health workers also, they also become tired out of that. So that we have to restrict the movement of the people who are coming from outside. And when in May, after May 7th, the stringent activities were eased out, and after that time, again cases are coming. Now the cases are coming. Once we flattened the curve more than anything, But after that, after month of May started, again the cases are coming. People are coming from abroad. People are coming from other states of India in hotspot area, from hotspot area. In our country, the large cities like Mumbai and Chennai become epicenter and hotspots of the virus. And so many Malayalis are coming back. As you know, lakhs and lakhs of Malayalis are outside for job and for tourism and for other business, etc. They are outside Kerala and they are coming back. Lakhs of them are coming back. Out of them, so many people are infected. Now we got more than 1,500 cases from this from this new wave. And again, we started all the works, our preparations and everything. We are continuing that thing. But the thing is that after May 7th, we got more than 1,100 cases. But we are insisting strict quarantine, home quarantine. We are insisting home quarantine. Someone asked us to have institution quarantine, and central government is also, they also said for institution quarantine. We have some institutions here. Even if in a house, a person cannot have proper quarantine, that means there is no separate room, bath attached or toilet attached room in a house. They cannot undergo home quarantine there. We are searching, we are finding out whether their houses have these facilities or not. If a person have no facility in their house, we are taking them to the institutional quarantine. Proper place we are finding out. Anyway, the person who who were coming out of who are coming out, they have to go to strict quarantine for 14 days. And our health workers and our people's representatives and our volunteers are observing this. Our Chief Minister is controlling everything, or he is leading from the forefront. And with the union of all the line departments, we are tackling this problem. The local self-government, the transport department, the police and health department, every departments are in hand to tackle this problem. And we are preparing, health department is preparing proper protocol, advisories, guidelines at proper time. We are in each and every day, we are examining whether any new action should be there. And we are giving directions according to our experience day to day. And we are in the field and we are working together for that. And now we are not afraid, because we have some tension or some frustrations, because when the number become very big, how can we tackle this problem? But we expected this, because 6 lakhs people were registered to come back to Kerala in our Norca cell, non-Kerala cell. 6 lakh people already registered to getting pass. We are issuing pass. We have some priorities, that the pregnant women and the old age people who want to come back to their native place, and also the persons who lost their job and nothing there to support them in other countries. They should get the pass, the nod first. They are coming back. But the fact is that the old age people who are coming back from Gulf or other countries, they have some comorbidities, and they are also infected with this virus. Whenever they come back to Kerala, at the next day or next moment, they are dying. And our death toll becomes 16 up to this day. It becomes 16 people succumbed to death. 13 from the new coming and 3 from the first part. And we tried our best to save their lives, but they are highly diabetic, and 3 or 4 died here, is suffering with leukemia or cancer, other kind of cancer, etc. And we cannot save them. We tried our best, but it is not succeeded to save them. And 4 or 6 are who are admitted in hospitals are in a critical condition now itself. We are worried that whether we can save them or not. But the other, or the most of the people are stable, and we are attending them properly. And this time, the contact cases become below 12%, 10 to 11% only contact cases, because our quarantine principles, our quarantine method, we can say it is success, because from 28 or 30%, this time the contact cases become only 12 to 10 to 12%, below 12%. That's a good sign, and that gives us some enthusiasm, and all our strategy is working here. And we are in the field. We didn't get back, or we are not thinking it is over or like that. But the thing is that Kerala cannot be as an island. Even the virus is there. If the virus is there in China, next Tamil Nadu, our neighbor state, and if the virus is rampant in Maharashtra, our neighbor state, we cannot stand still. People will come and go occasionally, and the virus will also come to us. And the scientists are saying, you are very eminent personalities here in the discussion also, you are saying that we have to live with the virus. Now we are practicing to live with the virus. We are forming some first line treatment center, first line COVID treatment center. We have COVID special hospitals in our medical colleges, etc. And we have 1,000 and that kind of beds in each and district. I'm not explaining these things. I'm taking too much time, because there are so many eminent personalities to speak in the this discussion. And if it become more than 25,000 or like that, we are going downwards to our first line COVID treatment center, and also to the primary health level, etc. We have a very good primary health system here, and with the help of that basement, we are trying our best to tackle once more this cruel virus. We are enthusiastic on that. We are waiting and seeing what is happening out of our hard work.
Thank you. Thank you, Shailaja Teacher ji. Really appreciate you sharing the insight and just hearing you out, all the things right from the Nipah virus, the way you handle, and I happened to watch that movie as well, which was great to see what was going behind the team, your leadership, and the great team that you have as well at all levels. And the primary healthcare center you mentioned, the volunteers as well, and all the healthcare workers, the frontline, and also the entire chain of workers all come into this equation. And I think hats off to you all, to keep all of us community safe here and in Kerala as well. So really appreciate what you've shared. I'm sure there are quite a few other things, and there are a lot of questions that are coming through as well, but I might just reflect on a few things. And one of the things which I've heard you talk a lot about is the reverse quarantine process. So this is something as you prepare or come into the next stage, and we haven't heard this much around, whilst we may be practicing in some form or shape, but that reverse quarantine process is something you've taken leadership there across in India. So would you want to share a little bit more on that?
Yes, that is the most important thing. I said that our contact cases are low because of this reverse quarantine principle. The vulnerable people who are above 60 and also with comorbidities, and also the differently abled, transgenders, etc. They are most vulnerable to this virus, and we want to separate them from the contact, or break the chain of the transmission from them. And we have a very good team. Our not only health workers, but I have another department in my portfolio called Social Justice and Women and Children. We have so many Anganwadi workers, means the small little one were admitted in the Anganwadi projects for women and children, the pregnant mothers and the little ones below 5 years. And that workers in Anganwadi, there are one worker and one helper. 67,000 workers are there in our state, and we are making use of them to watch whether the elderly are properly staying in their home. Not watching them, but also with our health workers, accredited social health worker, ASHA, and they should visit their home and find out whether they are getting their NCD medicines or non-communicable disease medicines for diabetes and cancer and That kind of lifestyle diseases are rampant in Kerala because our lifestyle expanded or advanced lifestyle we achieved because through our planning and planning throughout these years, people-centered planning, we can say, and most of the Keralites become the middle class or upper middle class, etc. We have poor people also here. We are trying to improve their life also. But because of that lifestyle, no exercise, but the eating habit change. Because of that, we have so many these kind of non-communicable diseases here. And we are watching thoroughly whether they are getting medicine, whether they are taking exercise, etc. Whether they have any mental problems there. Our mental health teams are working also. And we are keeping them away from the imported cases or important carrier persons, and that way we are protecting them. They cannot move outside freely, but some entertainment should be there for the old age people, otherwise mentally they will become disturbed. We are trying to entertain them also through so many projects and programs through the website or network. We are giving them, and that way we are protecting them. And one more thing, we have a very good campaign on Break the Chain campaign to prompt the people to have hand wash and use hand sanitizer, and also wearing mask, and also keeping the physical distance properly. We are teaching them, teaching all the people through these volunteers. Honorable Chief Minister had a call who were willing to work, willing to work with the against the coronavirus as volunteers. 2.5 people registered in that site. They are willing to work, and we formed volunteers out of that. With the volunteers, with the help of these volunteers, we are implementing the reverse quarantine perfectly. And that reverse quarantine is the most important thing, because here we have 16 deaths, out of which I think more than 90% are above 60, and I think more than 50% are above, percentage is above 70 and up to 80, etc. And we have to look after this old age vulnerable and children also, and the comorbid peoples. They should keep away from this virus. That is the only method. We are doing that thing here.
Okay, thank you for sharing those insights. Obviously, these preemptive measures are very important, and again, also gives us confidence as we address this. Now, I'm just cognizant of time. I might just have a quick interaction, one or two questions from the panelists for you. Professor Stephen, would you want to step in and have a quick check-in, any question or any query you may have? And of course, you are already operating in India, and you specialize in NCD and great Institute for Global Health. If you want to share your thoughts to the Honourable Minister.
Yes, thank you very much. Nice to meet you, Honourable Minister, and I very much enjoyed your presentation. We've been working in India now for 20 years, and really throughout that entire period, Kerala has been the beacon of success in terms of healthcare, and it has been very much for us a model that we have tried to work with people in other states in India to see whether we can help improve healthcare both at the primary care level and at the hospital level. And we know how difficult it is, and so it really is an extraordinary achievement that that you and your government have been able to make in Kerala. And I think the COVID-19 situation has really illustrated that not only is Kerala an extraordinarily successful state in terms of healthcare in India, but it actually is in the world. And if you look at, for example, I'm in the UK at the moment, and I can't get back to Australia because of the quarantine. But if you look at how things are going here in the UK, I mean, the UK is about twice the size of Kerala, and it has at the moment 300,000 cases of COVID and 40,000 deaths. When you compare how you've done in Kerala at half the size, there is really no comparison. And that is despite us having here in the UK a national health service that's free, as it is in Kerala, but clearly is unable to deliver the quality of care that you've been able to. So I congratulate you, and I think if it were possible, we would get you over here in the UK to see if you can sort out things here. But also, I should say that New South Wales has made and Australia has had terrific success in managing this epidemic. I was there right at the start of it, and clearly was very concerned. I think, as Scott has said, about the potential for there to be thousands and thousands of cases very quickly. And I think the fact that Australia has been able to limit the number of cases to, I think, about 7,000 with only 100 deaths is really an extraordinary achievement. And again, in stark contrast to the situation here in the UK. So I congratulate the Australian government and the New South Wales government for being able to achieve what you've done as well. Thank you.
Thank you, Steve, and really look forward to working with George Institute. Even in Kerala, we'll probably have more interaction with the rest of the panelists as well. On that note, I will probably invite Tanya, the director of the Australia-India Institute. I know you need to go quickly, but if you want to do a check-in in terms of how you see this whole Australia-India collaboration in the healthcare space panel, and reflect on the Kerala model as well, that'll be great.
Thank you very much, Irfan, and it's certainly a pleasure to be here with so many eminent people on such an important issue. I'm passionate about the right to health and universal health coverage, and part of my career involved representing Australia to negotiate in the World Trade Organization access to medicines and the Access to Medicines Declaration, which India was actually leading, to make sure that generic medicines can be accessible by those countries and people who need them. We are here today, I think, to talk about innovative approaches to health, both in terms of innovation in medical technology, as well as to policy. So on the policy point, obviously I credit Health Minister Shailaja for her incredible work. And as a former diplomat of Australia to India, I was also in India at the time when Kerala had to face both the Nipah virus, Zika as well, and now obviously the incredible work being done on the coronavirus. And I just have to say it's really a point of distinguishing. It's a very distinguishing feature of the state of Kerala under your leadership to have such a strong public health system. And I think the credit is due not just to the systemic strength, but also to the commitment to people and the dignity of citizens in accessing good, affordable and accessible health. And you obviously mentioned the ASHAs and the Anganwaris as well, who are critical parts of the health system. Others have already spoken about the way parts of Australia have dealt with the coronavirus. We are very fortunate to have such a strong relationship between Australia and India. As we all know, our Prime Ministers just met in a virtual summit. However, even before that, Prime Minister Modi took the initiative of calling Prime Minister Morrison back in March to talk about health cooperation and on the vaccines as well that could be developed from the coronavirus. Part of that relationship, I'm proud to say, I helped to foster by drafting the health MOU between Australia and India that was signed by Prime Ministers Modi and Turnbull back in 2017. Since then, Australia and India have strengthened even more the cooperation between the two countries, including on health policy, which is paramount, antimicrobial resistance, and non-communicable diseases as well. While coronavirus has gripped our health systems at the moment, as the Honourable Minister also pointed out, we can't lose sight of our other health needs. So I'll just highlight a few other case studies that the Victorian universities and research companies are also involved in and working with India as well. I'll just reference Victoria's Parkville precinct, which is one of the largest precincts in the Southern Hemisphere, made up of 40 hospitals, medical research institutes, and biotech organisations and universities. It deals with cancer as well as other non-communicable diseases, child and adolescent health, neuroscience, mental health, and sadly, mental health is an issue that has been gripping many with isolation. Part of the coronavirus has, of course, impacted citizens' other health needs as well. Infectious disease and healthy ageing. The Victorian state has 40% of all the Australian Stock Exchange listed biomedical or pharma companies of Australia, and they're looking to partner to do really good work for the benefit of our citizens and the future strength of health systems. I have to say I've done some great work with the George Institute, and I'm delighted that the George Institute invited me today. The George Institute also was a leader in Australia-India digital health, in which the Victorian Health Minister was there. This is about 3 or 4 years ago. So if Minister Shailaja, we ever have the fortune to have you in Australia, it would be a pleasure to introduce you to the Victorian Health Minister also. Victoria had their first coronavirus case on the 25th of January, and to date has 57 active cases. In a state of 7 million, which is quite small based on Indian numbers, it has done almost more than 500,000 tests. So that's quite a part of the population in order to do the tracking that's required. And as my colleague Scott Farlow said as well, that tracking, tracing, testing has just been a crucial part of the various state actors here in Australia. So it's certainly a privilege to hear your story, not just on coronavirus, but the other pandemics you've managed to shepherd your state through. And I look forward to the possibility of us cooperating in the near future. Thank you.
Thank you, Tanya, for sharing those insights, and I appreciate the great work you're doing between Australia and India in the healthcare space, and would love to connect both here in Australia and when we are back in India as well. So thank you for that. I might actually switch to Honourable Scott Farlow. Do you have a quick check-in with the Minister? Any things that you have to share? Of course, we've heard a bit of Victoria have to bat for New South Wales as well. So maybe we want to have a quick check-in with the Minister on any things that you see that we could collaborate between New South Wales and Kerala as well, especially the healthcare precinct which is being developed in Westmead and the new healthcare innovation precinct as well. Maybe you can shed some light there.
Yeah, well, look, I think a lot of global collaboration that New South Wales is looking for, particularly with the Aerotropolis and that when it comes to advanced manufacturing into the future as well. As my federal colleague Jason Falinsky mentioned before, I think that from this pandemic, Australia is not looking inward. Australia is looking more globally, and we definitely have seen some benefit throughout this pandemic in collaborating globally, learning from the rest of the world. But we also see some of the challenges we have with our supply chain, and that looks us to, of course, make more here in Australia, but also to diversify our supply chain around the world and look for partners as well. And India is one of those partners that we look to time and time again. New South Wales government has had a India strategy since 2014. It was mentioned our Premier is now the Australian High Commissioner to India, but New South Wales at the end of last year announced global New South Wales and looking more globally at partnerships. And one of the markets that we announced was actually to set up a new New South Wales trade office in Mumbai, and very much a focus on the Indian market from New South Wales and the New South Wales government. So when we see the return to travel, that will be a focus that we'll be returning to and looking at how we can establish New South Wales's global footprint and work more collaboratively, particularly in the Indian market as one of those key markets that we'll be targeting. And Tanya and I were actually on the Australia-India Youth Dialogue together in 2018. And a lot of those conversations, the George Institute was mentioned many times in terms of its work in India and its renown in India in terms of its global health footprint and the work it was doing in India. But there were a lot of Australian small startups as well that we were chatting with, and some of their key actors in terms of working with the Indian health system, working and collaborating in health in India. And I think one of the messages that I got out of that was particularly about how we needed to develop better relationships with India. And we had made the mistake in the past from Australia of perhaps coming in and expecting something to happen very quickly. And that wasn't necessarily the way things worked in India. People needed to see more of our commitment. And I think that that's something that was a key learning for me in going to India, that we need to continue to develop those relationships, to keep on coming back, show our commitment. And that's something the George Institute, of course, has been able to do over 20 years. And I think that the New South Wales government is intent on doing with our India strategy as well. So I look forward to collaborating more globally, and particularly with India, and hopefully with Kerala as well.
Thank you, Honourable Scott Farlow. I would want to check in quickly with Dr. V.P. Nair, who's again humbly accepted our invitation to have a different perspective from one of our friendliest neighbours in Singapore. Mutually, both India and Australia appreciates the partnership and the collaboration that we have with Singapore, and the whole presence of the Indian diaspora there as well. And Dr. Nair has been leading, one of our leading lights from origin from Kerala, but a senior cardiologist there, and also being involved in the front line. Let's hear from Dr. Nair, your thoughts on, not only the COVID, but also the future of healthcare collaboration globally. You're muted, Dr. Nair. If you can take the mute off. Dr. Nair, you're muted still. Yeah, that's better.
Now?
Yeah,
can you hear now?
Yeah.
Thank you very much, Irfan Malik, for inviting me to participate in this August audience, because this is a fantastic intellectual discussion that I heard so far, including the representatives from our neighbor, Australia, which is very close to us, not only for educational and other exchanges, even for our defense purposes. Australia is very important for Singapore to get all the necessary help. Now, secondly, I'm very delighted to hear from Shailaja Teacher from Kerala. I heard about you. I didn't have an opportunity to meet you, but today I'm meeting you through the air, through the cloud anyhow. So before I ask you a question, which will be soon, I first ask you a question, then I'll talk something about Singapore. Now that you have a reverse home quarantine for Keralites who are returning, or those who are infected, do you provide enough running water facilities and toilet facilities in Kerala? I'll come to it later. Let me describe about Singapore. Singapore, we have a very good health facility, one of the best in the world, just like Australia or UK or US or Japan for that matter. And in many things, we have collaborations with Australia, US, Japan, and so on. But our problem is that ours is a country where large number of tourists visit here. From the east, from the west, from China, from Australia, everywhere. There are millions of people coming to Singapore. So the first case of the COVID in Singapore was sometime 13th of January this year, even though the WHO declared on the 31st of December 2019. The first patient was indeed a Chinese national who came to Singapore. And subsequently, we had a number of patients. We didn't have a local spread. But important thing was that it started in the dormitories. We have 1.5 million workers in Singapore from various parts of the world, mainly from India and Bangladesh. And a large proportion of them are from Kerala. And we found out that in the dormitories, if one person goes to one particular area, they can spread. It's very, very strange that about 6 weeks or 7 weeks ago, one patient came to see me. I had done angioplasty and stenting for him for a long time back. And he came to see me saying that he got a chest pain. And I accepted him. He went through our quarantine system, no fever, nothing. When he came here, he said that he had a cough. He was treated by the GP, and an X-ray was normal about a few days ago. So I thought, if the X-ray is normal, he had a cough, why not I send him for a CT chest? And to my surprise, the CT chest wrote acute respiratory distress syndrome. COVID was positive. Now, I was in trouble because he came to my clinic. So the whole clinic was sanitized. my staff was sanitized, and we had been checking for COVID for the last 2 weeks, all negative. So 6 weeks, we have no COVID in our hospital or in the clinic. But what I'm telling you is that sometimes the patient can present in a different way, and you'll be getting into trouble. I packed him immediately to the infectious disease hospital. He was treated there for 2 weeks free, of course, and he recovered fully. So similarly, in Kerala also, you get people who are coming from Wuhan and other areas who are students. Singapore also, there are people returning from other countries, but at the moment they can't come. So our health facilities are good. And we are also in the treatment facility. We are already starting with the Remdesivir IV, which I don't know whether it is being approved in Australia. And we are also thinking in terms of vaccine production. I'll talk about it later when the other speakers have spoken much, because the time may be very limited.
Thank you. Thank you, Dr. Nair. Thank you for sharing those insights. Yeah. I'll invite Professor Jeremy Chapman, who's a very renowned professor, a very renowned figure in the New South Wales Health, and also leading the charge with the Western Sydney healthcare district and the development, which is going to see remarkable growth and also a new healthcare precinct coming up as well. So over to you, Professor Sir Jeremy Chapman. Really a privilege and honor to have you here. Thank you for you to share some insights and maybe interact with the Health Minister as well.
Thank you. It's a great delight. I have to say, Kerala is a standout and has been a standout for many years. And I can see why, Health Minister. Thank you for leading India forward. In fact, my last visit before the shutdown in early March was to India. I was in Chennai. I put myself in voluntary isolation for 2 weeks just before mandatory isolation came in and have remained well. I think there are some messages for us. The first is the high value of good traditional public health systems. And those that do not have them have suffered. Those that have deteriorated their systems or have health systems which are not really systems are suffering from it. It's not just the community. So I think strengthening the public health systems has to be an issue for both Kerala and for New South Wales to take from this. The second comment I've got is in the process of changing care, I think we were a little surprised that the community is not as connected as we thought it was in New South Wales. We saw it in education, we saw it in health. We have whole schools of children who have no access to IT on the internet. And certainly that is true across much of India. So relying on the connectedness of the IT world is probably something we're going to have to rethink. It wasn't in practice quite as good as we hoped. I'd like to echo Dr. Nair's problem and Singapore's problem, and that is to say that we have established amazingly connected travel systems. Iran suffered from the Belt and Road initiative by having large numbers of Chinese workers there very quickly. Singapore suffers by having a hub and major airlines passing large numbers of people through them. We have yet to work out how to manage that connectedness safely in the context of these pandemics. So I think we have much to learn from this, both as to how we return to business as usual and as you have in Kerala prepared for the next pandemic, because anybody who thinks it's not coming is clearly disconnected from reality. We will get more pandemics. We must deal with them. And at the core, I think it's the connectedness of our population, both in real connectedness that we have to deal with, the travel problem, and in the IT connectedness. Just going back to my visit to Chennai, we all knew that COVID was coming when we were in Chennai. And we all wondered what would happen in Chennai, and we all wondered why it wasn't happening. And it may be to do with the less connectedness of the community that it was delayed in arriving in force. It wasn't until later that you suffered, and I'd be most interested in your views on both in New South Wales and India on how we should be approaching the physical connectedness for the future, and wonder how to challenge ourselves to better control epidemic spread. Thank you for the opportunity to participate. It's been a very interesting time.
Thank you. Over to Dr. Christy Fernandez, obviously, who joins from Kerala as well, who's been definitely championing some of the Kerala state's development, industrial development, and also healthcare is one sector he's very close, and I've had various conversations. He's also part of the World Malayalee Council Family Leadership and Advisory. And yeah, I have had some great conversation around some of the initiatives and Bio 360 Life Sciences Park as well. So let's hear from Dr. Christy Fernandez, if you can share some insights on some of the initiatives on the ground happening as well, and where Australia and India can collaborate.
Well, ladies and gentlemen, thank you very much for this opportunity, and special greetings to our minister as well as to the political leadership of Australia. Well, the COVID-19 is certainly bringing about a paradigm shift in a variety of sectors, and health sector is one which is in the forefront. You must be aware of a study commissioned by the Australian government, which has submitted its report saying India Economic Strategy 2035. And it is a kind of very ambitious document. And according to that document, the health sector is one of the very promising sector. And from what we have heard, there is an urge, there is a willingness to collaborate, to cooperate, and to partner the activities in this sector between the two countries. This is a very welcome change, and we look forward to the activities in this under this banner. Well, you all know that the Indian health industry as of now is about $175 billion, and it is growing at the rate of about 17%. That is the size of it. It is only going to grow. It is not going to constrict. And you also know that in India, both the national government as well as the state government participate in the health-related activities. In the forefront, in the front line is, of course, the state government. So the policies of both the center as well as the state governments are important for the sectoral growth. The new initiatives that have been taken up by both these governments creates the scene much more investor friendly, more industry friendly. The ease of doing business reforms that have been carried out, as well as the foreign direct investment, which as of now stands at 100% in the healthcare sector. There is plenty of opportunity for both the countries to work together. I'm now focusing on Kerala's position vis-a-vis the healthcare sector and investment possibilities here. I will divide into two areas. One is about the healthcare destination, Kerala as a healthcare destination, where you find a lot of low hanging fruits which you can certainly harness. The second aspect is Kerala, the desirable as a desirable production hub. Why I'm saying very specifically, the amongst the various life science activities, one of the critical input is the medical devices. And in medical devices, India is still lagging behind. About 80% of the total requirement of the medical devices is still being imported. So it is a virgin area where many countries, particularly Australia, can also participate and look very closely. Diagnostics and medical devices, plenty of opportunities in that. So here you can manufacture specific products which is to suit your requirement. Your requirement not only for your country, but also for your export purposes to other countries. So this will be a win-win situation for Australia as well as for Kerala and India if you can focus on the medical devices sector. Now, coming to the healthcare destination, the health tourism, which is globally known, Kerala as a health destination, health tourism destination, that is something which you can certainly harness on. And and another good opportunity for investment is wellness centers. Government of India as well as the state government is now focusing on a new concept called wellness centers, where health is viewed in a holistic manner. This is an area where Australia can, and also other neighboring countries can look up to for serious investment. Health infrastructure, Kerala is fairly advanced in that, but even in Kerala, our health infrastructure requires further boost, and one area where you can certainly look at investment. In life sciences, biotechnology is one area where I find tremendous opportunity, mainly because of the biological hotspots that Kerala is known for. And Kerala is also known for a couple of things, very unique to itself. That is, one, qualified manpower, which are qualified people, but how skillful are they? How can they be skilled? How can they be trained to meet with your requirement? Is something unique which you can deal with manpower in Kerala. That is something which is very good. The R&D institutions, the rise of the small, medium enterprises in the health sector is providing yet another opportunity for investors. So I would rather limit my conversation at this stage, and we give incentives both at the national as well as the state level. At the state level, through the corporation which I chair, we provide support for startups as seed money for their initial expenditure. That is for innovation, incubation, and helping them to fund them with term loans as well as working capital loans, enabling them to set up manufacturing units, service units, etc. And then besides that, one major offer that I would like to make at this occasion is we have parks. One exclusive life science park near Trivandrum, which is our capital city, where we have about 200 acres of land, of which 100 acres is earmarked for medical devices. This is an opportune time for you to step in, where we provide the land as well as other basic infrastructure, common facilities, etc., enabling R&D as well as production facilities in that complex. We have an advanced virology institute already set up in this Bio 360 Life Science Park in Trivandrum, which is going to be one of the leading institutions in the sector in India. And other similar institutions are also coming up in that area. A great advantage of being in Trivandrum will be there are a number of education institutions, R&D institutions, and leading R&D institutions in medical in biotechnology, in interdisciplinary science education, etc., etc., coupled with the advantages of adapting and adopting some of the traditional medical care facilities, as in Ayurveda, which can be harnessed for nutraceuticals, if not for pharmaceutical purposes. Well, I'll be happy to answer question else as well. And we offer you all the best possible services and support from Kerala government. Thank you very much.
Thank you. On that note, I think I know the Honorable Health Minister has to go. A quick word, to inspire us all. How do we collaborate between Australia and Kerala? How do you see this collaboration pan out in the future?
Thank you, everybody. I think amongst all the challenges and this kind of pandemic and other challenges, we have some opportunities also, some hopes out of that. You all mentioned about the collaboration, and I think both Prime Ministers are in touch with each other, India and Australia, and they are thinking about some collaboration also. And I can say only about my state, because I am a health minister of a state in the government of India, under Government of India. And Kerala is also very much interested to have some collaborations. In Australia, there are so many reputed universities and institutions like Sydney and George, etc. And I think we have to have some this knowledge exchange or other kind of research and development studies and some collaborations, as you all mentioned, in the production sector, also the logistics and this kind of health, medical devices, etc. I think we can have some collaborations on that, because during these the challenges of this coronavirus, we find out that there is a scarcity of this kind of production centers here, personal protection equipment, N95 masks, etc. That's a simple thing, if we are in, we are fond of that, if we like to do that kind of work, we can make some materials, equipments here itself. We are thinking so. We started in some small scale things during this corona season, and we want to make it more large and with collaboration of from other part of the world and other part of country, etc. And we will try to do that. And as VP Nair is there in Singapore, and he talked about Singapore. Like Singapore, Kerala is also a thickly populated place. People are coming and going from Kerala, inside and outside. Has that kind of a floating population is there in our cities, and even in our villages there are so many foreigners here, and Malayalis are going abroad everywhere, and that is the state of Kerala. And I think we should have to prevent these things to protect the lives. At that same time, that gives opportunities to Kerala also to start new things. I can say that there is a silent revolution happening in the IT sector in Kerala, and for the startups we are giving so many novel things there for the startups, and we are doing something in that era also, and we can improve that thing. And also we should have some study about this pandemic and medicine research, and also some methods how to live with the virus. We should have to expect other virus. It will come definitely. We cannot prevent these viruses in the world. It is there, and we should have to prepare to live with the virus. And that for that also we can have some joint studies and some kind of research out of that. And also for the vaccine and medicine, etc. I am elaborating. Here, Sri Christy Fernandez mentioned about the indigenous medicine, and we are using the indigenous medicine here in the Corona challenge, for the Corona challenge also, for prevention. We are using the Ayurveda medicine in a large scale for the preventive activities. And in future, we can use it for the wellness. We are using that nowadays also. We have so many wellness centers here using Ayurveda, and we can, I think I am in hope that we can attract more people from outside for these wellness centers through Ayurveda, indigenous medicine. We are trying that also. We are trying to have an international research institute in Ayurveda here. We acquired 300 acres of land for that, and we have a very good master plan for this, a very good museum, research center, and specialty hospital, especially to have some research on Ayurveda. We have so many herbs here, a wealth of these herbs. It is in Western Ghats, there are so many special kind of herbs here, and we have to experiment with it. Our turmeric and our neem, etc., is famous throughout the world, and we want to have some experiment with that herbs also, that Ayurveda medicine also, and we are forming an international research institute in Ayurveda here. I think within 2 or 3 years that become a truth in Kerala, and we can promote the research in Ayurveda sector also, and that also we can share with other countries. We already had an international Ayush conclave here before 2 years, and papers from eminent papers from for 38 countries participated in that Ayush conclave. We are trying to have other Ayush conclaves, the large session of our this government. Because of this corona, our preparation work stopped actually, and we will start, definitely we will start it, and we can have another conclave in Ayush sector, international conclave. That also helps us to attract the eminent peoples and thinkers and scientists to Kerala, and also investors also. We want to have some investment from outside also. We are doing that thing. I cannot speak more, and no need to speak more, because all the personalities here is thinking this kind of collaborations and research, etc. They are very eminent person. I am only a minister, and I cannot suggest each and everything. I have a very good team with me, my secretary and my staffs, etc. And our chief minister is very much interested to have an advance in the health, not only health sector, but his words are to create Kerala as most modern. And we have 4 missions here in each and every part. In health sector also, we have a very good mission called Ardram, and out of that, with the help of that mission, we are converting our primary health center to family health centers, making all the public hospitals to technologically most modern. I am not elaborating these things, and it is going on. And Chief Minister have a very good vision and mission, and out of that we are achieving these things. And MP is participating with us, Scott Farlow and Jerry. Sir, you also give us very good points for our future thinking, and also Mr. Stephen McMohan, everyone who Tania, she left, but very good statement from her also. And I am hopeful that Sri Irfan Malik, thank you very much for arranging such kind of a Augustus discussion here. I got something in my mind for future action. I don't know, ours is a small state, you know, and in India, government should act on this. We will send our message or send our expectations to our government of India, and I think they will help us very much. And with Australia, some collaborations, it is a definitely great thing. It will become a great thing, and in future we can have some collaborations. We will try our best to do that, and with the help of Sri Irfan Malik and so many others who are staying there, they are Malayalis also, and they will also help us. And I want to say excuse to all, because I have a meeting with the Chief Minister just now, and I want to keep this. And thank you again.
Thank you, and appreciate you taking time, and we'll really look forward to working with you and your team. Great to work with your team, Health Secretary, KMSCL, all of them. We've been involved in collaboration already, and we look forward to working closely again more. Thank you.
Thank you very much, sir.
Thank you. Thank you. So on that note, I know we've run out of time. I might just take 1 minute in all. If I can have a quick few words, like 3 or 4 words of future between Australia and Kerala, India. We'll start with Dr. Christie. 3 words that come up in terms of future between Australia and India.
Well, to begin with, let there be a ginger group where you can identify the low-hanging fruits for rapid growth. Once that produces a result, automatically that will attract the attention, and then that is the beginning of the whole thing. It will take you to the.
Thank you. Honorable Scott Farlow, what are your few words to summarize or set the expectation for future between Australia and India?
Well, I think Australia and India are going to come closer together. We have a very shared outlook when it comes to the world. And I think it's in the best interest of both countries to work very closely together. And I think that's what's going to happen. And as we see the Indian diaspora in Australia grow stronger as well, that's our best link. The local Indian community is our best link to a growing India in the future. And I think that will cement the relationship.
Thank you. Professor Jeremy Chapman, any last few words about the Australia-India future collaboration, healthcare, and research and innovation, how we can closely work with your Western Sydney healthcare district as well?
I think we need to focus on our common interests, and we need to focus on where synergy will deliver us a better outcome than doing things separately. And there are many opportunities across the whole field that we can use to deliver that set of outcomes. So common interest and synergy would be the 2 things I would look for in any single project that is to be done between the 2.
Thank you, Professor Jeremy Chapman. Really appreciate your kind words there and vision as well. And we look forward to working and building that collaboration actively with the Western Sydney Health District as well. Professor Dr. Stephen McMahon, your final few words. You're already actively involved and delivering a lot of actions. Would love to see George Institute in Kerala very soon. And I think there's a standing off from Dr. Christy Fernandez, and I would love to see some presence at the Life Sciences 360 Park as well. So what are your thoughts? What are the next steps that you see between Australia, India, and Kerala in particular?
Well, I think from some of the work we've begun in Kerala with Dr. Devaki Nambiar, showing the quality of the care there and also the high levels of satisfaction. I think one of the key things for Australia is we're going to have a lot to learn from India, and I think that's going to be an important part of our future.
Thank you, Professor Stephen McMahon. Really appreciate and look forward to really facilitating and also achieving some of those outcomes. Now, on that note, I will hand over to dear friend Barbara Ward. Before that, a quick check-in from Dr. Nair as well. Singapore, yes. You're an independent observer, but also a close associate, both sides. What do you see are your thoughts of global collaboration?
Yes, Singapore is developing a vaccine in collaboration with Arctus Therapeutics from America, and we are also in the phase 3 trial. I'm sure that Australia will also be interested in developing vaccines. And we also have a very good health system, and our experience in the health system can be shared with Australia as well as with Kerala and any other part of the world.
Great. Thank you, Dr. Nair. Over to you, Barbara, my friend. And if you can sum it up. And thank you for, again, patiently being there, all the audience and all of you who are listening globally. And over to Barbara to, express the thanks and wrap up the session. Thank you.
Thank you, Irfan, and thank you, everyone. I just wanted to touch on that, my take on healthcare. I think that it's like many other disciplines, it's an ecosystem. Everything is connected to everything. I think through collaboration, we can strengthen global healthcare. There's a deep and depth of knowledge and experience that we can share. We can sustain longevity, promote and harness interprofessional collaboration, and indeed, there's economies of scales. I think COVID-19 has taught us to rethink our model. I think it has taught us how to build relationships, nurture them, and manage and conduct ethical business. Australia is a relatively young country in comparison, but Australia needs to keep its strategic influence at the fore, more integration capacity, and take the lead in collaboration and cooperation. On that note, it brings me to do the vote of thanks. Once a great man whispered, feeling thankfulness and not expressing it is like wrapping a present and not giving it. So today, I would like to take the opportunity to put all my gratitude into words. On behalf of InQ, World Malayalee Council and Government of Kerala, and everyone else who's involved in bringing this seminar, it falls upon me to give the vote of thanks. I hope you enjoyed this session as much as I did. COVID-19 global collaboration in healthcare research, innovation, supply chain, and healthcare services. I think we all learned a lot from today. Let me begin by thanking our chief guest, Honorable Minister Shailaja. Even though she's not here, I'd like to thank her very much for taking the precious time in consenting to be a speaker. Her words were very inspiring and I certainly learned a lot from it. So thank you, Minister G. I thank our distinguished guest, Scott Fowler. Thank you, sir, very much. We know that this is a busy time for you. Therefore, we are honored that you were very grateful to be here today. So thank you for your presence. We were also very fortunate to have Jason Blinsky, Federal Member of Parliament. It was very generous of Jason to be with us today, given that Parliament is sitting. And as you could see, he had to leave because he was called out. But a huge thank you to Jason. Our sincere thanks to our high-profile panelists, Professor Stephen McMahon, AO, Professor Jeremy Chapman, AO, Dr. Nan, Dr. Fernandez, IAS, and Tanya Shishra. Thank you all for sharing with us your intellect and your views. I thank all the supporters and sponsors, the George Institute, Impact One, Kerala Startups, Australia-India Institute at India, Breathe Easy, and our media partners, Metro Co. Can I thank Irfan Malik for his passion, his tenacity, and hard work in bringing this incredible seminar together in a very short period of time. Thank you, Irfan, for everything you do and everyone that's been involved in behind the scenes. Of course, nothing would be possible without our wonderful audience. Thank you for being part of this and making it a success. This is the first of our many planned seminars, and it is our hope that the outcome will be one of greater dialogue, further collaboration between the state of Kerala and New South Wales, and the two countries, Australia and India. With that, ladies and gentlemen, we hope you found tonight's session informative and thought-provoking. Once again, thank you, and I bid you good night. Good night.
Thank you. Thank you. Namaskaram to all of you. Thank you, and thanks for joining again, and we'll stay in touch. Thank you. Namaskaram.